Now it's my pleasure to introduce Carrie Booker, who's going to be facilitating our amazing panel that's made up of several members of our Pritzker leadership team. Carrie is the Assistant Commissioner of the Division of Early Childhood from the New Jersey Department of Education, which is responsible for programs from birth through grade 3 educational initiatives. Mr. Booker's worked in the education field for close to 30 years, and before joining the Department of Education, he served in high-level positions at various institutions, including the Academic Foundation Center, Educational Opportunity Fund program at Rutgers University, and he was also the Senior Policy Advisor for Governor Murphy. He completed his doctoral coursework in social psychology at the University of Texas, and he earned his Bachelor of Arts degree from Amherst College in Massachusetts. Carrie, thank you so much for doing this for us, and we're looking forward to this great panel discussion.
It's my pleasure. Thank you for that wonderful introduction. And I think I hit unmute and started my video, so I hope everything is coming through as planned. Good morning, I am Carrie Booker, and it is a pleasure to be a part of this important collaboration that has really been going on for the last year on this discussion. I'm joined today by a great panel of 3 women who have been part of the leadership team in this ongoing conversation. So I'll be joined by Natasha Johnson from the New Jersey Department of Human Services, Lenore Scott from the New Jersey Department of Children and Families, and Caitlin Mulcahy from Montclair State University Center for Autism and Early Childhood. And you've heard in the conversation today a few themes which have been at the forefront of the report that's coming out, that's being released today, and of the conversation that has taken place to result in this report. So when folks have talked about quality, they've talked about equity, they've talked about the importance of engaging parents and families, and of course, of late, the big challenge that we are all wrestling with is the impact of COVID-19 and how that has highlighted some of the challenges that we have and added to those challenges. So I'm going to let the panelists introduce themselves, and I will jump right into the conversation because I think we have a lot to talk about and want to get it all in the time we've been allotted. So I will ask Natasha to introduce herself, and also looking at the report, if you can sort of sum up your first reaction in a single word, and then if you would start by talking about the importance of quality in our childcare system and in our efforts to expand childcare out to more families. And I will certainly start with the one word that I think of when I look at the report and think about the conversations and discussions that we've had, and that word is love. You know, this is a labor of love for the people that have been involved in this conversation, and for the ACNJ team who has really led us and kept us together and kept us focused on this work. And love is the word that comes to mind for me. So Natasha, would you start us off?
Sure. So good morning, everybody, and thanks, Carrie. So my name is Natasha Johnson. I'm the Assistant Commissioner of the Division of Family Development in the New Jersey Department of Human Services, and I too am very excited to be here this morning and to have been part of this process, and along with my colleagues, just part of our process as we've been building our early childhood system for a number of years here in New Jersey. So I think the report has been a great labor of love. And I think as I love the picture on the cover of the report, because when I look at the face of that child, I just think innocence, right? And what is really what we're here to work for. And she's it. So I just really, that picture just speaks volumes for me. So I'm sorry, Carrie, what's the second question you want me to answer about? Because I'm stuck on her face and the innocence of that child. I could be there all day.
So you're bringing to us sort of the anchor point of childcare, and
Yes.
So much of our conversation has focused on the importance of quality. So we know that simply expanding this and saying we have more is not enough to get the kind of impact that we know that that childcare can offer us. And so quality has been sort of central to the conversation, so that as we grow with quality.
Yeah.
So would you sort of take us through some of the quality components of what we talk about when we talk about expanding childcare?
Sure. And so for me, when we talk about quality and quality childcare, it really starts with the science, right? Sort of plain and simple up front. And we all know the importance of brain development. I always have to go back to those early years of a child's life and how important that is, even starting from the pregnancy, before the child is even born, and the proper nutrition and the child's experiences with other people and how much that plays into for that child's life, right? What those experiences mean. So we know that parents and caregivers have a critical role in that brain development, from how they speak to a child, how they play with a child, how they care for a child. So to me, quality childcare is critical in that development because, you know, from our well-trained and credentialed teachers to evidence-based curriculum, exposure to books, songs, stories, that language development. So like all of those things that we know are the things that kids need. And if you don't have that in a quality environment in childcare, that's not a positive experience for those kids, right? So I just think quality early learning environments in general are critical to healthy growth and development for infants and toddlers. And I think childcare is a den for that. And so that's why we've been so focused on quality childcare and making sure that we're providing support to our providers to be able to provide that for kids.
Thank you, Natasha. So can we jump over? Lenore, can you take the thread of quality into our conversation about home visitation?
Absolutely. So good morning. I'm Lenore Scott. I'm the administrator of the Office of Early Childhood Services here at the Department of Children and Families in the Division of Family and Community Partnerships. Long thread there, I understand. I oversee several state and federal initiatives that include home visitation, our central intake system that you heard about as well, the preschool development grant, Birth to Five, which is a collaboration across 5 state departments, as well as several other programs. So all of those initiatives that I oversee are to ensure that the services and supports reach families early and prevent child maltreatment. So one of the goals of home visiting is really to improve the physical and emotional well-being of infants, children, families. And I think, as we heard in all of the previous discussions, as well as in Tasha's comments as well, quality is really interwoven in these services, right? And so one of the things about the home visiting programs that we have implemented here in the state of New Jersey is that they're all evidence-based, right? So they're steeped in research. We do continuous quality improvement to see how, one, if we're, maintaining the way that they were proposed to be implemented. Are there any adaptations that we need to make, based on who we're serving? So I think it's really having a CQI approach. And I think that's one of the ways that we're incorporating quality in these home visiting services. So when I look at the picture, I did bring a smile to my face. And I think the word that that came to mind was responsibility, right? I think it is our responsibility to maintain that look of wonder that you saw in that baby's face. And so that's
Thank you, Lenore. And so, Caitlin, would you take a minute and introduce yourself as well, and talk about how we think about quality when it comes to infant mental health?
Sure. Thanks, Carrie. So I'm Caitlin Mulcahy. I'm the Associate Director at the Center for Autism and Early Childhood Mental Health at Montclair State University. Similarly long thread like Lenore. So for me, when I saw the picture, I saw connection. I also saw hope, but I know we were only saying one word. So, so connection that in some ways, without that hand held, the potential and the hope for that child may not be realized. So that's something that we think about a lot in the field of infant mental health, which is not, as it sounds, potentially like a little baby on a couch in a psychiatry office, right? It's actually the relational, emotional, and social development of infants, toddlers within the context of their families and the context of that family in the community that they grow and the context within which they live. So, so quality there is that we care about the earliest moments of family development. And in fact, that shouldn't be radical, you know, and we've been talking in this Pritzker process of this big, bold goal, and we heard Diane speak about that before. And I think in the current context, probably it is bold, but I encourage us to question whether it should be bold. And in fact, maybe that's a construction that we don't need to participate in anymore. That actually supporting young families at the minute that they start becoming a family, which is in pregnancy, that family becomes a family at that time. That if we, you know, so amazing, if we decided that we were going to support those families in their relational, emotional, and social development at that time, which we know from Natasha and from the science is the greatest period of brain growth that we'll ever have again in our lives, that really shouldn't be a radical, bold situation. That should be what we do as a society. So that is quality, is to support families at the earliest moments of their development. And when we do that, we have to do it considering the relationship that that child is being born within and that that family is growing up within.
So thank you for that, Caitlin. And so I want to fold into the conversation the equity piece, because it was a central part of our conversations. We've heard from all of the previous speakers, equity as a very critical component to the work that we're doing. And it is a piece that even Pritzker is focusing on and pushing all of the members of this coalition to focus on as well. And, you know, equity, even in my boss in the Department of Education has made that a major focus as well. And so if we can talk a little bit about how we think equity and what we're doing to focus on equity can drive this work as we move beyond today's report. And why don't we reverse the order, and Caitlin, why don't you kick us off?
Sure. So within infant mental health, there is a tremendous disparity to how families are supported in their relational and emotional development from their first moments. And that has a lot to do with how, again, we've structured the idea of mental health. We oftentimes hear mental illness when we hear that term, mental health. We think of it much more as an intervention way down the line than we do as a promotional and preventative measure that all should have access to. That if we provide the strong foundation of emotional relational development from the beginning, we likely won't need as much work down the line. We won't need to invest as much down the line, whether that be in mental illness treatment or in what oftentimes we end up doing for people who don't have the strongest relational or emotional foundation, which is go to incarceration. So, or at least some sort of more punitive way of addressing that work. So there's a few things that I think we need to think about when we're addressing infant mental health services for infants, toddlers, and their families. And the first is access. So right now we don't have the enough capacity in providers, and that's both in clinical mental health providers, but also for all of our adults who are interacting with young children, that they can also consider themselves as being supportive of the relational and emotional development of young kids, but that they need to see themselves such. So I'm sure Natasha will speak about this, but that goes back also to compensation for all of us who work with the youngest of our civilization and community. There's also an issue in terms of payment. So if a family is in need of larger, more intensive infant mental health services, right now it's very difficult to access. Medicaid doesn't reimburse easily. And the number, again, of providers is very, very few. So I think there's really those three things. It's access, capacity, and the awareness that all of us who work with young children should be thinking of ourselves as supporting this. And therefore that goes back again to compensation and respect for the workforce that is intersecting the most readily with infants, toddlers, and their families.
Okay. Lenore, you want to fold in the home visitation piece on how we talk about equity when we talk about home visitation?
True, yes. I also want to really talk about just for a minute that as a department, one of the things that I can say is that our commissioner is dedicated to looking at racial equity as well. I think one of the things that she's formed and is a race equity committee, right? Because thinking about the work that we do in our department, we recognize that, you know, children 0 to 3 are the most vulnerable, right? And so when we think about their vulnerability, thinking about some of the topics and things that Caitlin was just talking about, right? Access becomes an issue. And so when we think about home visitation, part of their work is how do they promote access? How do they promote health equity? Part of the work of home visitation is really looking at eliminating, you know, some of those disparities. But I think the one thing we cannot forget is that home visiting is really embedded in a larger system at this point, right? And so when we heard some of the other presentations, recognizing that with our maternal morbidity outcomes, right, they're the worst in the state, and that's because of structural, right, racism. So I think those are some of the things that we have to really keep in the forefront. And I think, you know, as Diane talked about, that's some of the things that we're looking at through this work. But through home visitation, we're really looking at improving pregnancy outcomes, improving child health and development, right, as well as helping and assisting parents with economic self-sufficiency, right? So we know that poverty, again, that it's unequal. And I think the chart in Jerry's presentation spoke to that very clearly, right? And so some of the things that we really try to do through this work is really connecting folks with employment, with other resources that are necessary, and helping particularly our young families, our young parents continue their education. Because we know that that's a gateway to better access. But I think that through all of these things, and I think in one of the slides as well, it really talked about how we really try to be culturally sensitive. But I think at this juncture, with the way things are today, that we really have to be clear in calling out, because when we're hiring our staff, we, you know, again, it's important to hire people who look like you, who understand, you know, what you're going through. So I think those are the things that we try to do, attempt to do. And I think that as we're continuing to look at our work, that we need to find strategies to continue to do that better.
Yeah, and really see communities as resources for support and resources to help us do our work in those communities. Natasha, can you add to our conversation on equity?
Sure. And I think really just to not repeat what Lenore and Caitlin said, because I think we have the same thoughts on this, is that the first thing that came to mind for me is access, right? I think that's an important first step in how we do this. And I also look at childcare as, you know, about how ingrained that is in all of our lives, right? You have a child, you work, you go to school, your kids are in childcare for a good part of the day, right? So you want that access to childcare to be, one, a early learning environment, preferably a quality one, right? And then we have early social and emotional screening and access to all the things that kids need to prepare them, not just for school, but just for life, right? So I think that access piece is important. And I absolutely agree with Lenore and Caitlin on the other points. The only thing I'll add is that I think a cross-agency collaboration is another way that we address disparities. I think it was in Jerry's presentation, Diane mentioned it earlier as well, in the video that she showed to us. And I think we've been doing a great job over the last couple of years of just coming together at this, just cross-agency and across the state to say, so who is in home visiting? Who's getting early intervention? Who has a childcare subsidy? Who's in Head Start? Who's in the preschool program? Who's receiving SNAP? Who's receiving TANF? Like I could go on and on and on with that list. I think if we have to come together to know that these things are all support and service to families, but we don't need to be doing them in isolation. And we have to come together if we're really going to talk about structural racism, talk about how programs are supporting families. We have to do that in a way that we're communicating with each other so that we're better serving the families that are receiving our services. So I think that, and even what we're doing and what we did in the last year for the Pritzker, for this project was a big piece of that as well. I think those things have to continue for us to continue to be able to look at disparities in the way that I think we should.
Yeah, thank you for pulling that out of the conversation. One of the things that comes to mind is our current emergency around COVID-19, which has certainly highlighted some of the inequities that are in our system and has really challenged our approach in all of the work that all of us on this panel do day to day. But I think we've also had some important lessons learned in this experience, and perhaps we can take a moment and maybe highlight a few of those. And Lenore, I can let you lead off this time.
Absolutely. And I think one of the things that we are truly, truly proud about is how we were able to maintain services during this pandemic. And I think one of the things that was really amazing, that in some instances, our engagement with families actually was quite higher, right? And so I think one of the things that we're learning through this process is that delivering these services, it may need to be a combined approach, right? We know that home, being in the home face-to-face is important, but I think being flexible and resilient during this time are two of the things that two of the most important points that we've learned, right? I think recognizing that sharing cell phones, tablets, I think we're all, are going through that, educating our kids, but not necessarily having the necessary support to be able to do that. So I think that's some of the things that we're recognizing, that how do we, one, broaden our bandwidth with our internet access, right? So again, it goes back to access, and that not all of our families are have that availability to be able to access internet on a day-to-day basis.
Yeah.
And so I think the biggest thing that we've learned as well through this pandemic is that in many cases, home visiting is the only access and connection that families have to primary care, to other linkages, to safety net resources. So we're staying diligent and figuring out how do we incorporate some of these new lessons learned. And as it's become I hate to use the term, but it's been coined quite a bit, the new normal for us. How do we make sure that we continue to engage more and more families?
Yeah. Natasha, you want to weigh in on
Sure.
childcare and some of our lessons that we've been learning?
Well, so I think the biggest just general lesson to me is that we have to listen, right? And I think that we have to be responsive in how we make policies, and we have to be able to change, right? Because I think historically we make a policy, that's the policy, we just sort of live with it. I think in the current situation we've in, and we've done a lot of work, Carrie, with you at the Department of Education and with DCF, as we had to implement just emergency childcare, right? And understanding that we had to be flexible, we needed to listen, we needed to change things if we needed to immediately, because we had to meet an immediate need and do it quick. So for me, I think in general, as we continue to move forward, we have to listen, we have to clearly communicate, we have to provide information and support to people that need it, and we have to be flexible in the way that we make our policies, and be comfortable with the fact that we may have made a decision in March that's not now appropriate in June, and that we have to adjust and make some changes.
Yes, and very, very important point, as we have definitely learned a lot of new approaches and had to shift gears a lot in these last few months. Caitlin, can you weigh in a little bit on sort of some of the lessons learned and what you're seeing in
Sure. So first, as a not person who works at the state level, I also want to just share my thanks to all of you for how responsive you have been. I think it is not a common situation to have something come that leadership doesn't have answers to, and then leaders have to create something, that is as responsive as possible. And that is a very tricky position to be in. And I wonder how many of us are in that position where in our spaces, we are the people to whom others are looking for direction and certainty. I imagine a lot of us on this call today are in that position. And we often go, well, somebody above us might know, and so for you at the state, I appreciate that, that you were able to take that mantle on. But for all of us, I think something that we at our center think about a lot is a lesson that comes from T. Barry Brazelton, who was a pediatrician in Cambridge. Some of you might remember him. He was very popular earlier in the decade, or I guess the century maybe. But he talks about value opportunity where there is disorganization. So valuing disorganization or a moment of disorganization also as an opportunity. And we can think about that in terms of what Lenore said, which is how we connect with families, right? So this very public disorganization might allow us a more intimate connection, even if we're in a virtual setting. Or to Natasha's point, this very public disorganization might allow us an opportunity to rethink how we might have been doing things in the past. And I would like to even offer that even on a macro level, this very public disorganization might have brought more to the awareness of those who don't work with infants, toddlers, young families, as in the same way that many of us do, that all of us are at risk of falling to economic uncertainty, of direction uncertainty, of health uncertainty at any minute. And so wouldn't it be smart for us to then do what we can to ensure as much of a foundation in those incredibly foundational aspects of being human, which includes health, financial, emotional stability, relational stability. Like what can we do to change how we've been using this disorganization as an opportunity to move forward? In the infant mental health field, we've just been waiting. Oftentimes in times of stress, we meet the earliest needs first, and then we realize what we just went through. I'm not sure I'm not sure we know quite yet what we've been going through. It's not over also. So in the emotional world, we wait. We do as much support as we can, and we assume at some point soon we will be there to support those of us who have been supporting this much, including families.
Yeah, and that's a very good point. I think we're all sort of paying attention to what the lessons learned in this have been, and adjusting as we can draw meaning from the experiences that we've been having to be better. So we have probably just about 3 minutes left, and I didn't want to end the conversation without talking about the importance of engaging parents and families, and just their voice in this process as we look to deliver increased services, better services, and so if we can take a minute a piece and sort of fold that into the conversation. And let's Natasha, why don't you lead us off?
So I think it goes back to just listening. I think we need to talk to parents about how they're feeling, what they're thinking, what they need. I think we need to get feedback, and I think those are the things that we need to incorporate into what our next steps need to be. So I'll even go less than a minute, Carrie, and say I think we just need to, I think that's important.
All right, thank you. Lenore, why don't you jump in?
Absolutely, and I'm just going to tag on to Tasha's statement. I think, we're a working group. This is why it's so cohesive, right? And I think as we're thinking about bringing in new home visiting models through this initiative, right, I think it's important to have families tell us what it is that they want. And so to your point, I think it's having, listening to them, but also having them be part of the process, right? Helping them be part of the co-design so that it's not just a thing that we do, but it's really meaningful and useful. So less than a minute.
Creating opportunities for families to be heard.
Yeah, absolutely.
Caitlin.
Yeah, so it's not going to be surprising. I mean, I echo my esteemed colleagues' statements as well. I think I'll just add that that this begins in pregnancy. So to be sure that we're listening to families during those critical months. And given our COVID reality right now, the birthing process has changed so drastically. And to be able to listen to those families who have experienced birth during COVID, where many of them are being discharged from the hospital in 12 hours, to not being then seen potentially in person, right, by people. So again, back to listening, but to keep in mind that this work starts then, that I really believe very strongly that if we were to show the respect necessary to families at the earliest moments of their development, that we would all be in a very different place down the line, and to really challenge ourselves. If we hear that as radical, really challenge why we think that way. And how do we not just think that is what we should do as a human community, really. So listening, and then again, remembering how early that listening needs to start.
Here,
that's
here, here.
a
Agreed,
beautiful
Caitlin.
final point. And I just would like to say to our audience how, and I think I can speak for the panel, how very much we have appreciated the leadership of SEAL and the ACA Advocates for Children of New Jersey team in their work to really curate this conversation and this work that we're doing. Though it has been an 8-month conversation, this work has been going on for a very, very long time in New Jersey. It is why we are so well regarded. And we are very, very lucky to have such leadership in our advocacy community and expertise right here at home in New Jersey. And we're grateful to be a part of that conversation.
Well, thank you, Carrie, and thank you for those very kind words, and thank you to the panel. More than anything, I hope it gives everyone on the call a flavor of what our discussions were like. It probably, for me, was the most exciting, challenging, and inspiring process I've ever been involved in. ACNJ set the table, but everyone who came to the table came with trust, with creativity, with commitment, with incredible ideas, putting aside silos, putting aside how we've always done business to talk about how we can create a different beginning for our most vulnerable children. And as I've learned from Caitlin, we did it in partnerships. And those partnerships and relationships are the key to how we create that better start for all children in New Jersey, especially those who do not otherwise have access, as we certainly has been heightened by everything we've experienced over the last 3.5 months. So let me close by first thanking our many partners, our incredible leadership team. You have met some of them today, Carrie, Natasha, Lenore, and Caitlin, but there are other members of that team as well. They are listed in our report as well as in the executive summary. They came to the table over an 8-month period to really dream and vision what we could achieve for children. But they were also joined by many, many community partners, starting with our Think Babies Coalition that kicked off in 2018. And as I listened to the presentations today, I looked to see who was participating, and many of you are participants in that call. So thank you, and we want to continue to in partnership with you. Also, I want to acknowledge and thank the parents and community partners we've met along the way, the providers that provide direct service in the community. We've met them through focus groups, through meetings, and most of all through our Strolling Thunder, our annual event to make babies a visible priority for our state leaders in Trenton. I think we have learned from you, and as Natasha said, we want to continue to listen. And I want to extend special thanks to Diane Delano from the ACNJ staff. We have a fabulous team at ACNJ, but Diane headed this process and I think did an incredible job, as you could see from the plan that she presented. So let me close by talking a bit about what I see as next. So I'm going to ask you, please read the report. Start with the executive summary. It's all there. Why this is important, what we can do, how we can come together. And as everyone on the panel talked about, stop for a moment and take a look at that beautiful little girl on the cover. She says it all to me. She says hope, potential, but even more trust that we will make a difference for her. And when you read the report, think about how you can join us. We need your creative thinking, your commitment now more than ever. We're facing incredible challenges, but as Caitlin said, and it's been a theme through this discussion, there's also an opportunity to think about how we can do things differently. And then I'm going to ask you, let us know, how can you join our movement to unlock the potential of all young children in New Jersey? We have an incredible environment. We have leadership from the governor and certainly from Mrs. Murphy, as you heard this morning in her inspiring remarks. We have the support and the trust of the Pritzker Children's Initiative. And as Jerry discussed, there's a strength behind us, our partners in other states, what Jerry is offering to assist us with. It's an incredible opportunity. Our leadership team, our partners, this is a moment in time that we have to seize to make sure that every child in New Jersey has the potential to grow up safe, healthy, and educated, and that New Jersey is the best place to have a baby and raise a family. So thank you for joining us today. Please check us out. The link to the report is in the chat box. You can check it out on our website and let us hear from you. We want to hear from you about your response and your ideas. Thank you again for joining us today.